morning everyone. Myself Dr. Saurabh Bagga. I am a consultant cardiologist at Fortis Hospital Shalimar Bagh. So today we'll have some knowledge about the pulmonary hypertension. So what this pulmonary hypertension means? So as we know, we call hypertension as a routine term the increase in blood pressure, but here the term is the pulmonary hypertension. So these are the two different kind of hypertension. As we know, the heart has 4 chambers, 2 upper, 2 lower. The right side of the chamber pumps the blood into the lungs. So anything which leads to the increased pressure over the right heart, that to pump the blood in the lungs because of the lungs problem, can lead to the increased pressure in the right side of the heart, and this increased pressure is called pulmonary hypertension. So the pulmonary hypertension can be because of the blood vessels in the lungs which get thickened, destroyed and swollen. So right side of the heart has to pump more aggressively, more forcefully into the lungs. So the pressures in the right side heart get increases, and that this leads to increased pressures and thickening of the muscles of the right side of the heart, and eventually it leads to the failing of the right side of the heart, and which leads to the symptoms because of this hypertension, which is called as pulmonary hypertension. So there are different kinds of group of pulmonary hypertension. Generally 5 groups are classified. They are like idiopathic, some because of the left side of the heart valvular problem. Third one is because of the pulmonary lungs problem. Fourth, because of the different kinds of clotting problems in the lungs. And fifth are due to different diseases like kidney, tumors, inflammatory diseases, connective tissue disorders, blood disorders, which can lead to the increase in blood pressure, increase in the pressure in the right side of the heart, that is the pulmonary hypertension. These different groups have the different presentation and the treatment. We will discuss accordingly. So generally the patient present with the symptoms and signs which are gradually, means there is a gradual progression of the symptoms over a time, and the symptoms are generally increased fatigueness, breathlessness, pounding heartbeat or palpitation, that is leading to atrial fibrillation, swelling over the body, that is a pedal edema, abdominal distension, neck swelling, and dyspnea or syncope, that is a fainting. So these are the symptoms which is the presentation of the pulmonary hypertension. So patient initially has a very few symptoms, and over a time these symptoms progresses. So we have to suspect the patient who are having mild symptoms which are progressing. So we have to evaluate for the pulmonary hypertension. There are various tests to find out the cause and the pulmonary hypertension. So basic tests are ECGs, blood reports, and the echocardiography, which shows that the pressure in the right side of the heart has increased or the muscle gets thickened. So which label the patient has a pulmonary hypertension. For cause, we have to evaluate further. Why? Because this pressure has increased. So we have to evaluate other findings, and we have to do tests like CT angiography, perfusion scan, and other tests to diagnose the connective tissue inflammatory kidney disorder, which leads to the pulmonary hypertension. If we go for the treatment of this kind of pulmonary hypertension, so according to the classification or group of disease or the disease which has leads to the pulmonary hypertension, if we diagnose that, so we can lead to the proper treatment of the pulmonary hypertension. We treat the primary disease, the blood pressures in the lungs and the right side heart get decreased. The therapies which are available to treat this pulmonary hypertension are those therapies which dilate the blood vessel in the lungs, so the blood flow in the lungs get increased and the patient's symptoms get improved. So there are many drugs which are available for this pulmonary hypertension. So if we diagnose the patient in an early stage, we can prevent the disease to progress over a time, and patient get symptom relief early and have a good lifestyle and a disease-free life. The pregnancy is one of the most dreaded thing to be have in pulmonary hypertension, because if the patient has a pulmonary hypertension and the patient get pregnant, it is very threatful to the life of the patient. So this is all about the pulmonary hypertension. Thank you.